So this is the receptionist dashboard. Their role is to admit a patient and release a patient. Yeah, so let's add a patient. Now, depending on the urgency level of the patient, the receptionist can either choose to select normal or emergency. If they select emergency, then the patient is directly routed to the doctor. They don't have to go to the triage section. You can select the mode of payment they'll be using. If it's insurance, they choose the insurance they are using, and then they enter their policy number. If it's cash, it just goes to the next level. If it's M-Pesa, if it's card. So after they choose the mode of payment the patient is going to pay with, they can either select a specific service if a patient wants a specific service, or if they just come for a checkup, they don't have to toggle that. And then if they need specific medications and then leave the hospital, you just toggle that button and then search for the medication they've come for. So say they come for paracetamol, and then select. So after you add to the queue, you can see this alert over here. It says new patient created successfully. So this is the patient ID. The patient ID is automatically assigned to the patient, the date they visited the hospital, now where they are at. So this status implies the stage, or the stage they are. So in this case it's billing, since they've just come for medication and they don't have to see a doctor, so it goes straight to billing, and then they can pick the medication from the pharmacy. So if you had chosen another service, say for example laboratory, the status here would have shown laboratory. So let's check. So this is the patient. So from here the receptionist can see each patient and where they're at. So for instance, this one, Brian Jones, is supposed to go to billing. So the receptionist can tell the patient to go to billing, clear the bill, and then pick the medicine. So the person at the billing will tell the patient what to do next. So the system itself tells the patients or the service providers what to tell the patient. So for instance, this is another mock patient we had put here. So John Doe is with the doctor. The receptionist can see. So if someone comes to the hospital and wants to see maybe Winslas, the receptionist just logs in and sees Winslas. Winslas requires completion. So if it requires completions, this means Winslas has seen every part of whatever they've come to do at the hospital. Now they just want to be discharged. So I think that's pretty much it on the receptionist side. So as you can see, we have on their dashboard, on the receptionist dashboard, you can see these tabs: active patients, total inpatients, completed today, and emergency cases. So let's complete a patient so that you see the flow. So say Winslas. So if Winslas has seen the doctor and the doctor has has prescribed some medicine and he's okay to go home, is directly routed to the receptionist, and after they clear the bill, so the receptionist completes them. Uh, so as you can see, this is Wensla's, the information, the billing breakdown. So this the service charge, they did a service which charges 1200 shillings, and the bill has been paid. So you just complete visit here, and they'll be removed out of the queue. Yes. So if you want to print a receipt for Wensla's, you just click OK here. Okay. So we have to yeah. So as you can see, it's been cleared. So there's no Wensla's in this active patient queue. He's been completed, so he's good to go home. So yes, that's the receptionist and their role. Also, there's this feature over here of selecting an emergency. So if a patient comes in, maybe they've had an accident, you just select an emergency and they'll be given the priority to see the doctor immediately. So yeah, that's it from the doctor, from the receptionist side.